The newsday continues here on One News Now. I'm Riza Diaz. Health Secretary Francisco Duque appeals to health workers to not be too picky with their vaccines. While attending the second vaccine rollout in Cardinal Santos Medical Center yesterday, Duque assured that all vaccines approved for distribution are of top quality, safe, and efficacious. He thus called on healthcare workers to not think twice before getting vaccinated.
Huwag na po tayong magkaroon ng agam-agam. Huwag na po tayong mag-alinlangan. Huwag na po tayo magduda sa pagiging ligtas at epektibo ng mga bakunang darating sa inyo. Sapagkat ito pong mga bakunang ito ay dumaan na po sa napakamahigpit na pagsusuri gamit ang mataas na pamantayan ng kaligtasan, kalidad, at pagiging epektibo. So please do not even doubt for 1 second about the safety, the quality, and the efficacy of these vaccines.
Meanwhile, when asked if the Philippines is now seeing its second wave of COVID-19, the health secretary said it's still too early to tell. He attributed the rapid rise in new cases to the 2 SARS-CoV-2 virus variants currently making rounds in the country. Duque then stressed the importance of enhanced public health standard compliance. Along with the usual protocols of wearing masks, face shields, and social distancing, Duque said everyone must also stay in well-ventilated areas and reduce interactions with other people.
Maaga pa para magsalita ng second wave, no? Patuloy ang monitoring ng ating Epidemiology Bureau at ang ating mga regional and local epidemiology and surveillance unit officers, no? So, we will see after additional more days, no? Kung ano yung pattern. Yung spikes ngayon cannot be solely attributed to the variants.
Around 10 elderly healthcare workers in Cardinal Santos Medical Center received a Sinovac vaccine. This despite the well-known fact that the Chinese vaccine is not recommended to be used for those above 59 years old. In fact, several high-ranking officials like President Duterte, Health Secretary Duque, and Defense Secretary Delfin Lorenzana begged off from receiving Sinovac shots, citing their old age. Still, SCMC Chief Medical Officer Dr. Zenaida Javier Uy said that around 10 healthcare workers who are of senior age received their first dose of Sinovac.
Fortunately for us, that's around almost 150 doctors na senior citizen kasi. Although some of them got the Sinovac already yesterday.
Cardinal Santos Medical Center.
Cardinal Santos received 1,300 doses of Sinovac, but almost 2,000 healthcare workers in the hospital signed up for inoculation. Uy also echoed Duque's sentiment that people shouldn't be too choosy with their vaccines, saying that the available shots are even more precious than gold.
So if it's available and I'm giving it to you and you say no, then that's your choice. Because you have to go back to the end of the line if and when you decide that you want to get it.
The rapid rise in new infections and hospital occupancy rates in the metro are surging or spurring fears that we might be seeing a second COVID wave in the country. To shed light on that, we have with us Special Advisor to National Task Force on COVID-19, Dr. Ted Herbosa. Dr. Ted, good morning.
Good morning, Risa, and good morning to the televiewers and listeners.
Doc, let's address the issue. Is the Philippines seeing or under the second wave of the pandemic?
As what Secretary Duque said, it is too early to say because we have an increase in our number of cases for the past week. That is true. But to say we cannot flatten this curve or it will continue to be the second wave, then that's probably too presumptuous. So we usually are able to say it's the second wave by the time we peak or by the time it's already decelerating. Remember last July, August, we peaked at about over 10,000 new cases every day. So we're now tripled over the past couple of weeks from 1,200 cases a day to yesterday, I think over 3,000 cases. So there is honestly an increase, but these are all distributed in different areas like the Cordillera Autonomous Region, parts of NCR, and parts of Region 7 or Cebu, Metro Cebu. So when we say you cannot say it's already the second wave because the increase in cases might not be due to the wave, but due to the increase in mobility of people, maybe in the decrease or carelessness of the minimum public health standards. So if we just reinforce those, probably we can flatten the curve back to below 1,000 cases a day.
Doc, new infections have exceeded the 3,000 mark for 2 days now.
Correct.
What could be causing the spike?
Well, number one, of course, the same public health standards that we have imposed, and because there is more mobility, more people gathering, relaxation of the restrictions of quarantine measures, we can see more people interacting, and that's a possibility for increased transmission. The second is people becoming careless, using less face cover, the face shield and the face mask when they interact with people. And the third is more people are now getting relaxed. They're confident that the cases are low, and this has led to our increase. Now, there is that side possibility that the variants have also entered, and indeed there are reports of different variants in different places where we have clustering or increase in number of cases, and this has been identified as both the UK and the South African variants have been identified, although it's not yet the predominant variant, but this may be causing some increase in transmission.
Doc, would you recommend tighter restrictions now that we're seeing a surge in cases? And do you think the government should hold off its plans to reopen the economy?
I don't think so. I think last year there's a lot of uncertainty of what works and what doesn't work. Over a period of several months, we discovered that our principles of prevention, detection, isolation, treatment are correct. So I think as long as we follow the principles of prevention, which is really the and then being the face mask, the hand washing, the avoidance of mass gathering, and then the second is really the testing. So once you have clustering, the idea is not to lock down, but to go to an area and make sure that all close contacts are tested, all secondary contacts are also quarantined, and even the third level contacts are also identified. So that in case they develop symptoms, we test them immediately, and if they test positive, we isolate them or put them in a quarantine facility immediately to protect transmission. So this works. This has worked for us in the past year without any vaccine. And this is the same measure with or without variants. So even if we have the South African and the UK variants, we still need to do the same public health measure. That means test, trace, and then treat, and make sure that it doesn't progress.
Doc, what would you say about the government reconsidering opening or reopening leisure establishments like cinemas and the resumption of face-to-face classes given the current situation?
I think the request of the Department of Education was to allow to open in areas where there are no new cases being reported. And I agree with that. If the region or the province or the city probably has no new cases for several weeks, I think these are places where that possibility can be allowed. But in cases where there is an upswing, like in Metro Manila, for example, you have an increase in cases in certain cities, especially the cities where we know the increase is high, over 300% over the past several days, then I wouldn't allow face-to-face. I wouldn't even consider doing the face-to-face. So it's going to be a case-to-case basis if they still want to do that. But my personal opinion is that we're at the end of this school year and semester. Remember, school usually ends somewhere, even if they extended it, it ends sometime in March, April, depending on when they opened it last in mid-semester. So because it's ending, why would we change? So my suggestion is just finish this and prepare for next school year, which is sometime in June or August. We can do the next school year. And we decide that we will do blended or limited face-to-face. So in some subjects, Like in the US, I'm just in a conference with my relatives in the US. They do all online, but their labs are done on a limited face-to-face. So maybe that's something we can do for the next school year.
Doc, how will the emergence of these new variants affect the country's vaccine rollout?
Well, basically, if you have an increase of variants, you'd want to increase your vaccination program. I mean, the speed in which you vaccinate the population and get to the level of the herd immunity is something proven. Israel showed this when they vaccinated very quickly a large part of their population. Their number of hospitalizations decreased. So is it in the UK and the Scotland, wherein they also showed a tremendous decrease, even if they were establishing. However, because we're not a vaccine producing country, we are so dependent on the delivery, our orders to these vaccines, and how they come. So we are not in control of that. So luckily we have about a million vaccines that have arrived, 500,000 from 600,000 from Sinovac, and another 480,000 from AstraZeneca. I believe today we're also expecting some deliveries of the COVAX AstraZeneca still. So that will increase our number of vaccines available to be deployed. So these vaccines have been deployed in different regions, and the problem is they're all supposed to be given to the health workers. And health workers number to about 1.8 million. And even if we get 1 million doses, that's still going to go first to the health workers. And you've seen some of our government officials begging off and making sure that the health workers get protected. Because if we increase our cases, what will happen is they will come to the hospitals and the doctors will be exposed. So it's very important that we protect the health workers so that we can continue to battle any increase in transmission or any second wave if it does occur.
Doc, since you mentioned that issue, is it okay for health workers to choose their preferred vaccine brand as to what is or which is more, effective for them, or should they immediately get the shots?
I think the principle has been very clear from the start. You get what is available and what is given to you. The best vaccine is the vaccine that's available because waiting can make a difference. Like, for example, now we have two. We have Sinovac, which is only up to 59 years old. That means the senior health workers may have to sign a waiver if they want to get it. So they take on the risk that there is not much studies with seniors. But then there are senior doctors, as you saw, that signed up in your report at Cardinal. Some of the doctors were also seniors. Maybe they're young seniors, so that's why they feel they're closer to the 59 age group and signed the waiver. However, the more senior doctors can now have AstraZeneca, which is the one which arrived from COVAX facility. And the age group is higher, up to 65, I think, or 85 even. It's been given to senior citizens in many parts of the world. So I think there is a choice. The problem is the Zeneca just arrived the other night, and it needs to be distributed. So it takes time to be redistributed to the different health facilities. But if you're in a hospital and Sinovac arrives and you're 59 and below, I suggest you get it already.
Doc, hospital occupancy rates in Metro Manila are reportedly increasing. Is this something that would have to be cause of an alarm?
Not yet, no, because the critical care utilization rate hasn't gone up above 60%. It's about only 50 plus. But it came from a low of about 25, 30% admission rate. So private hospitals, which have a smaller capacity, only 10% of their allocated hospital beds are for COVID. But at the Philippine General Hospital, where I'm from, we had to reopen another COVID ward because of a couple of weeks ago, we had about 60 to 70 cases only in the hospital. Now it's gone up over 100. So you can see that there's now more admission. The thing I'm looking at is what's been reported is that many of the cases that are turning positive have mild to almost asymptomatic cases, which means they just go to a quarantine facility and not a hospital. So maybe the new variant spreads very fast because there are almost no symptoms, or the symptoms are mild and they feel they're probably just tired or they have a sore throat, and they can infect other people because they continue to move around. So I think what we should increase is really our temporary treatment and monitoring facilities and our what we call the Oplan Kalinga hotels, where we can isolate people who test positive for the virus. So I think those are the strategies. It's the same strategy we did. There is nothing new, no magic in terms of what we did last year to flatten the curve. For this new other sudden upswing, we must just continue to do those things diligently.
Doc, one last question. Could you clarify rumors that some hospitals such as PGH and Makati Medical Center are now almost at full capacity?
I don't know about Makati Med because Makati Med is smaller because it's a private hospital. They're only allocated 10% of COVID hospital. And if there is an upswing, let's say in Pasay, which is near Makati, probably they will be having some admissions and maybe full. At the PGH, we're still at the 55, I think, or 56% capacity. So we have a larger capacity of over 160 beds, and we have what's called a surge because the Philippine General Hospital is a huge hospital with several personnel, and you also know we were one of the first places where vaccination of health workers occurred. So I think we have a capacity to surge. So that target is actually moving. So we had one ward alone already for COVID. We just opened the second ward again. That's because we had 2 or 3 wards before when we were at the height. So we have that capacity to surge. So that's a moving target, that question of we're already full. We're not full to capacity, but we can actually surge. So you have nothing to worry about. The doctors and the health system can still cope. So, but we need to do the prevention mode. We need to be stricter and conscious about making sure we don't catch the virus.
Thank you for your time and for your insights. That's Dr. Ted Herbosa, Special Advisor to National Task Force on COVID-19. And those are the top stories of the hour. Join us later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.